Hey everyone, in this episode of the Need to Know Show, we're going to talk about pain catastrophizing. What is it and what role does it play in your knee replacement surgery? Hey everyone, so today we're talking about pain catastrophizing. And let's just start with what is the definition of pain catastrophizing? What does this mean? And what it is a negative emotional and mental response to actual or anticipated pain. So this is a psychological process that's kind of maladaptive, leads to these bad kind of negative beliefs that you have about pain and what causes pain in your body. So it causes you to kind of ruminate and obsess about pain and what causes pain, and if I do something, it might cause pain. It leads to this feeling of helplessness, and there's nothing you can do, and I'm hopelessness as well. And it gives you this feeling of excessive worry and exaggerated tension and thinking and thought related to pain and your body's experience with pain. And it's really a psychological effect, a mental effect of someone who has persistent pain. So, for example, someone with knee pain and arthritis, but it can also, of course, be someone after knee replacement surgery. You have persistent pain. It comes from surgery instead of something else, but it is persistent and chronic pain nonetheless. So, the same way that anxiety, fears, and depression can play a significant role in your experience of pain and your recovery from knee replacement surgery, this thing called pain catastrophizing and this real emotional and mental response and feeling of hopelessness and helplessness and exaggeration of experiencing pain can really have a detrimental effect on your recovery from knee replacement surgery. And what they have found that people who show these characteristics of pain catastrophizing have worse prognosis than other individuals after knee replacement. So they have persistent pain, there's a decrease in your level of physical activity, a decrease in your level of function. There's this fear avoidance. So basically what that means is you're avoiding certain activities and certain physical movements and things because you have this feeling that if I do those activities, it's going to lead to pain, it's going to lead to damage, it's going to lead to injury, and all these negative consequences are going to come from it. So it leads to this overall just disability mindset and occurrence of the person. And it really can be very bad. It can decrease your function. It can decrease your health. And so something to keep in mind is this is something that is definitely prevalent and definitely occurs in a lot of people, both before knee replacement surgery and after knee replacement surgery. And if you're someone who has these characteristics, these psychological, mental things going on, and it's not something that's negative. It's not something to punish you or to say that you're doing a bad job. It's very normal. It's I don't want to call it a disease, but it's something that is not always controllable and very oftentimes not controllable. And so it's something that, not to punish you or not to say you're doing a bad job, but something that you need to be aware of these characteristics and these thought processes, because they're going to cause this domino effect and lead to the potential and increased potential of having these negative outcomes from your knee replacement surgery. So what you want to do is really have a proactive approach and say, look, these things are real things, and these are things that probably the majority of us who go through a knee replacement are going to have to deal with. The pain catastrophizing, but also things like fear avoidance, things like anxiety and fears of the surgery and potential outcomes from surgery and depression. And we have to address these things in a proactive manner and not look at them as something that we have to hide and something that we have to keep quiet about, but something that we should be very open about and share. And then in that way, we can get the help, and individuals can get the help that you need. And that's, talking to professionals, talking to your doctor, talking to your surgeon, but also talking to your physical therapist, and maybe even, talking to a psychiatrist or a psychologist, someone who has a little more understanding, a little more grasp on the psychological, on the mental and emotional aspects of going through something significant, such as a knee replacement surgery or having persistent and chronic pain. I think more and more, this is just kind of an aside, but as health professionals and taking a holistic approach of treating the individual and treating the person, is even this person comes in with an injury and maybe it's just you're dealing with knee pain. But at the end of the day, that knee pain is affecting your whole body. It's affecting your whole person and being. And it's affecting your quality of life. It's affecting you emotionally, psychologically, mentally. And so if we truly want to treat a person in a holistic manner, I think more and more we have to take advantage of and utilize both people who are dealing with the mental health, the professionals, psychologists, psychiatrists, people of that nature, health coaches, but also doing that ourselves. So physical therapists can be a resource for this as well, and doctors can be as well. We have knowledge. We might not be as knowledgeable and as up on everything as a psychologist, but we know about the effects of pain and the effects of going through a knee replacement surgery, and we can help individuals if we're willing to step out of our comfort zone and do that. So that being aside, so if you're someone who, be aware of it. Be aware that pain catastrophizing, anxiety, these psychological and mental things can definitely play a role both before surgery and after surgery. And be proactive about seeking out treatment. If that's cognitive behavioral therapy, if it's doing your research online about different things, about pain management strategies, about just the course of knee replacement surgery and what to expect from it. If that's getting involved with a social group, either online or in person. If that's getting social support from friends or family that you know who can help provide that support for you. Whatever it may be proactive and look forward and look to deal with these things in that manner. And, as we said, if we have these characteristics, if these mental and psychological components are present, it really affects your prognosis and your outcome and your ability to have a great outcome from knee replacement surgery and be happy with the outcome. So if we don't address these, then we're kind of doing a disservice. As a health professional, it's doing a disservice to the clients and to the patients. As an individual, it's kind of doing a disservice to yourself. So be proactive, get the help you need, and don't be afraid to talk about these topics that can be a little touchy sometimes. This has been the Knee Replacement Therapist, the Need to Know Show. We were talking about pain catastrophizing, what it is, what's it have to do with knee replacement surgery. Thank you very much for watching, everyone. As always, please be sure to subscribe if you're watching this on YouTube. If you're watching this on any other platform, leave a like, leave a comment, leave your questions, and I'll be sure to help you out and get back to you. Have a great rest of your day, everyone, and take care.